Hello, I'm Dr. Chris Miller from Full Swing Physical Therapy and Wellness. Today I wanted to talk about the new phenomenon, tidying up with Marie Kondo. Phenomenal series on Netflix if you haven't seen it. One of the big things that she involves in her sessions is sorting through your clothing to see which items spark joy in you. So the way she suggests doing that is putting them in a giant pile on your bed and going through each item to see if it makes you feel good or not. So if you're trying to do that, it can take minutes to hours depending on how much clothing you have, and especially if you have knee pain, that can be pretty daunting to think about. How am I going to make it through all of my clothes without my knees feeling terrible afterwards? And that's exactly what I want to talk about. So there's a couple options that I would recommend. First of all, just in general, avoid this position. It's awful on every body part. Avoid this. If you're able to do it, sitting on the side of your bed, like this. If your back also hurts, this might not be great, but for your knees, it should be okay. That way you can kind of get to things, sort through it that way. Or I'm going to simulate this because I don't have a table nearby, or you can pile them on the dining room table so it's at a nice, easy, reachable height to you, and you can sit comfortably in a chair. The biggest thing with that is make sure you get up every half hour or so to avoid your knees getting stiff. Just keep, break it up into 30-minute, sorting segments, walk around a little bit. The last thing is if you have a dresser that's up at your waist height, or heck, I guess even the kitchen counter, you can put some of the items up high at waist height to have you standing up and sorting through it, and that'll help prevent your knees from getting as stiff as they normally would, preventing from getting swollen, and those would be my big recommendations. Keep it waist height, try to be comfortable while you're going through it, move around every 30 minutes, and it shouldn't be as bad as you think, at least from the knee pain side. I don't know about the closing, but if you have any questions, please leave me a comment on the video, call me, text me, whatever you prefer, let me know, and we can go through a specific suggestion for what you're doing. So thank you. Talk to you soon. Bye-bye.